Now to stories of survival during this pandemic and the health workers risking it all on the front lines of the crisis right here in the United States. Owen Rogers is a registered nurse with HCA, Healthcare's Plantation General Hospital, and he joins us now to talk about what life is like on those front lines. Owen, thank you so much for joining us. You know, one of the things that we've been highlighting, obviously, as we cover this pandemic are the number of people who have passed away, sadly, from coronavirus, COVID-19. But I want to know from you, what's it like for you and your colleagues and other healthcare professionals when a patient recovers from this, especially a patient who has struggled quite a bit?
Well, I would like to thank you guys, first of all, for having me on the show and for celebrating nurses this past week. Listen, on the front line, it's always amazing to watch a patient go through something so traumatic and come out on the other side. It's with this scenario, with COVID-19, that's actually how we're seeing it play out often. There are a tremendous number of deaths with this, but in our facility, we have had patients who have recovered, and we celebrate each and every single one of them.
So if you haven't had the opportunity to be in the hospital, you may not sort of be aware of the amount of work that nurses do. If you've ever been in the hospital, you realize that you might see a doctor once or twice a day, but you're seeing nurses all day long. Can you just give us a sense of the role that nurses play during this pandemic compared to what doctors are doing?
Well, it's as far as a nurse's role, I think the most important thing with COVID-19 is sort of squashing some of the anxiety that's attributed to COVID. It's something that we are going through together as a community, as a team, and we have our patients that will come in, and the anxiety levels are through the roof. So as a nurse and our doctors as well, our physicians as well, it's very important for us to just help them alleviate some of those fears.
You know, Owen, one of the things that we've tried to do in reporting all of this is to not let folks get numb to the numbers of people. In other words, when you hear 76,000 and the number continues to climb, sometimes it's hard for people to put numbers to faces, to families, to loved ones. But one of the things that I keep thinking about for you, nurses and doctors, but mostly the nurses who, as Anne-Marie pointed out, are always in those patient rooms, is the fact that oftentimes people who are very close to the edge, very close to losing their lives, are not able to be in contact with their family members. In fact, the only contact that they have will be with nurses like yourself. What is that like, and how do they react to seeing a familiar face every day when they're unable to actually touch and see their own family members?
Well, I can't imagine as a family member what that's like, but it's our duty to empathize with that. And what we can do as nurses is essentially just communicate what's going on. Let them feel what they're feeling. Let them understand their fears, empathize with the pain that they're going through. We can also communicate with the loved ones that are in our care. You know, the questions that are being asked, you know, through FaceTime, if the patient's able to communicate, we can organize meetings. We can organize opportunities for them to communicate. But again, this is just an unprecedented time for us as a society, but in the system in healthcare, we're dealing with things on the fly, and having a loved one go through something and be close to death, and having no ability for any of their ones that care about them to be around them, that's not natural. That's not the natural process of life. So we can facilitate that. But I think one thing we can do that's important is just to allow people to feel what they're feeling. Let them hurt. Let them come to us for comfort, and comfort them when they want it. Let them be angry. Can you imagine what it's like to be told you can't see your mother, and she's at the end of her life possibly? There's no confrontational nature in a nurse when it comes to that. You let them feel. You let them be what emotion is going to carry them through this process, because we're all feeling it together. It's the challenge is being met, but it's being met as things evolve on a day-to-day basis. We're figuring this out as well, and I think we're doing an amazing job. But that is probably one of the most challenging scenarios and situations that we have to encounter, and we do encounter. I've personally encountered that, and I was able to offer a hug, and it was a long hug, and there were tears. And you know what? That may have made a difference for that day. And I could go home with my chin up, but until personally confronted with a challenge where it's my loved one, all I can do is just let them feel, you know?
Oh, and you know what I find really, really sort of fascinating about this conversation is thus far, we have not actually spoken about the medical work, if you will, what many people think about as the medical work that nurses do, the helping to intubate a patient or, change their IV bags, or we're not talking about any of that stuff.
Yeah.
You're talking about all this other stuff that I don't think people really recognize is valuable work that nurses do. And I want to ask you, when you talk about empathizing, when you talk about giving a hug, when you talk about allowing a patient or a loved one to get angry and let that out, do you think of that also as a type of medical intervention? Like, it's not an intubation, but do you think it has an impact on the health of the patient?
Absolutely. It doesn't have the same impact that an IV or an intubation would, but you know what it does is it keeps hope alive. And that's one of the things that you can lose the quickest in this scenario is hope. With the onslaught of information, the fear that everyone feels. I'm not scared. I think it's natural to be scared. I think it's unnatural to want to put one foot in front of the other in a scenario like this. But that's what we're doing. And if a hug can give that patient and that family hope for the day, then social distancing aside, that's what's going to happen. And those are the most important interventions, if you ask me. That's what matters. That's what nurses really do. The doctor's going to give us some medications. We're going to organize a plan of care. And believe me, they're just as empathetic. And we are just able to, with more hands-on with the patient at times, see those situations. I've seen doctors, physicians, nurse practitioners, physician's assistants. We've all been in the scenario where that's it. All I can do is give you a hug, give you a smile. I can listen to what you have to say. I can empathize with what your fears are. And we can work through this together, because that's how we're going to get through this, is together. This isn't about me. This is, all the nurses that across the country would say the same thing. It's not about me. I show up, and we all show up with the expectation that we're going to be confronted with a challenge that day. And I think we all toe the line, and we do the best we can. I have my assets. I have my faults. When my strengths, I will present and with an open heart to every single patient that I come in contact with, and every family, because it tends to be with the COVID patients more family contact than patient contact most of the time, because they want information about their loved one, period. And I would too, so I don't blame them for that.
And finally, Owen, 2 points, I guess. One, obviously, in addition to all the empathy that you display for the patients and their family members, most nurses are also highly trained medical professionals. In other words, you know a lot about the human body and what goes on. You know a lot about the procedures that have to be performed to allow patients to heal. And oftentimes, you, nurses, doctors, have been on the other side. You've actually been patients yourself, and you know what it's like. I know I spoke to our own Dr. Tara Narula, who's a CBS News medical correspondent, and she told me the first time she became a patient, that opened up her eyes to the way that individuals react to interacting with nurses and with doctors. What did you take from your experience as being a patient? You went through a medical situation yourself.
I did. I was diagnosed with a brain tumor in July of 2012 and spent 6 months recovering. And you know what? Some of the things I would tell anybody when it comes to a challenging situation is one, it's okay to be scared. But you have to continue putting one foot in front of the other. You can't stay still and sit in the fear. It will eat you up. I would say live your best life. I try to send that message to my patients is live your best life now. Because, before I had the brain tumor, I was going to be an 80-year-old man with a wrinkly hand holding my wife's 80-year-old wrinkly hand. But I understand more than ever now that that's not actually a guarantee. And I convey that to my patients. And For me now, it's easier to empathize. It really is. I can feel it with a sharpness. It's easier to understand their fears as a patient, regardless of what our patient presents to our emergency department with. It's their emergency. And I've come to really understand emergency is subjective in nature, but it's their emergency. And it's not my duty to judge the extent of it. It's my duty to treat it and calm some of their fears. So, it's empowering to be a patient, but for a nurse. But I think the most power comes from taking what you experience and handing that back to the patient in whatever form you can. And for me, it's simply just listening more, understanding the fears that they have. And it couldn't have come at a more perfect time. And in the environment of COVID, it is a scary time. Patients are scared to come to the ER. No matter what their situation is, that normally they would have dialed 911 for, or they would have come in via car. They're not. Some of those people aren't presenting due to fear of COVID. So, being a patient was a horrifying experience, and I got a lot of value. I got a lot of love. I got a lot of understanding, and I got a lot of information about my scenario from the nurses and the doctors that cared for me. So it's an absolute honor, and it's an absolute pleasure for me to be able to hand that back to my patients. It truly is. All roads in my life have led me to this, but I've found my niche in the world, and being a nurse is amazing. So.
Well, I think that we, as a country, have a lot more appreciation for the work that you and your colleagues do. Owen Rogers, it's been great talking to you.
It's been great. Thank you. Thanks for having me.